on the NewsChannel 5 network. This is OpenLine.
Hello everyone, welcome to OpenLine. Very important show tonight. We are talking about essentially the real world consequences of not getting vaccinations. We're seeing more and more cases where there are outbreaks of measles or some other thing that could be prevented if people got vaccinated. And so we're going to talk tonight with Michelle Fiscus, Dr. Michelle Fiscus, pediatrician, also Tennessee Immunization Program Medical Director, about what we're seeing in other parts of the country and what we're seeing here in Tennessee, and just the overall importance of getting vaccinated. But what are we seeing? What are the real world consequences where people are not getting vaccinated?
Thanks. Vaccines are so incredibly important. I think that the thing that probably most of your viewers are most aware of is the measles outbreaks that we're seeing right now. And we now have 15 states that have reported cases of measles. This is a disease that we weren't seeing in the United States at all for the last decade or so. I mean, maybe a sporadic case that came in from international travel, but not where we were having outbreaks in states like we are now. So just in this first 2.5 months of 2019, we've seen almost as many cases as we had in all of 2018, which was a high year for cases of measles as it is. Folks need to be concerned about measles. There's a couple of reasons why. 1 to 2 out of every 1,000 people who get infected with measles will die from measles. So folks will say, oh, it's just a rash and a fever. It is not just a rash and a fever. Kids don't die from a rash and a fever, but they can die from measles. And then about 1 in 20 or so people will get pneumonia from measles. People don't think about that. There's a high hospitalization rate, and then even if you survive measles, especially if you're a very young child who gets infected, you can develop a brain condition that occurs way down the road, sometimes years down the road, and that condition is almost always fatal. So even if you get through the first infection, you're at risk of developing complications much further down the road. So we have an incredibly effective vaccine. 1 dose of that vaccine prevents 95% of cases in people. 2 doses of that vaccine prevents 97% of cases in people. So if you had measles and I was sitting across from you, there's a 97% chance that I'm not going to get it from you because I've been vaccinated.
Wow, that's great.
If I've not been vaccinated, there's a 90% chance that I will get it from you, even if you left the room 2 hours ago.
So I'm fascinated just your day-to-day life. I mean, here you are, Tennessee Immunization Program Medical Director. Mm-hmm. You get a call that there is someone with measles on a plane, mm-hmm. and there are Tennesseans that were on that plane. What happens next?
Yeah, so anytime we get a report of a possible case of a highly infectious disease like this, it takes resources from the state. So we have, so in your scenario, someone from Tennessee is on a plane. So we get notified by the CDC that someone has been on a plane with someone who had the measles, and then we need to send someone to go track down that person, either by phone or in person, find out if that person's been vaccinated. If they haven't been vaccinated, we need to convince them to become vaccinated. And then in most cases, if we can get them vaccinated within just a couple of days of their being exposed, we can prevent measles. But if we're outside of that 3-day window or so, then that person needs to be actually kept out of the public for a period of time until we know that they don't have measles. Like many of these diseases, you're contagious before you break out in the actual symptoms of the disease. And so we actually have to quarantine people who have been exposed to measles who are not vaccinated for 21 days, waiting for them to become infectious.
So how often is something like that happening? Someone's quarantined as a result of a concern about measles.
So if you are unvaccinated, then, and you have a known exposure, we know that there's a 90% chance that you're going to contract measles, and that you're going to start spreading that measles days before you become infected or show signs of infection yourself. So for example, in New York, where we have a large group of people who are not vaccinated and an ongoing measles epidemic, those kids who are not vaccinated have been excluded from school for months because they can't be allowed back into the school system because they don't know if they're incubating measles at that time. And since they refuse to be vaccinated, they're kept out of school. So that's been the case in a lot of places. New York actually just also passed I don't know if it passed as a law or as an ordinance, but they're keeping unvaccinated people out of any public spaces in the area, that one county of New York.
Rockland County, New York.
Exactly.
As of midnight Wednesday, so this was just recently, they took the extremely unusual step to ban unvaccinated minors from public places amid a measles outbreak.
So that's parks and churches and synagogues and any place where more than 10 people can congregate by their definition.
Is it that bad? Have we gotten to that point?
In that particular county where they've had more than 100 cases of measles in a very small area, it's that bad because they have a very large population of unimmunized and therefore highly susceptible people there.
When you look at, all right, so how is Tennessee doing? So in New York, Washington State is another place where there are a lot of unvaccinated people, and you call it an outbreak. There's an outbreak of the measles.
Texas.
So we're seeing this where there are outbreaks of the measles.
Correct.
And that comes from lots of people not being vaccinated, right?
Right.
What do we see in Tennessee?
So far we've been lucky. I probably shouldn't say that we're lucky. We have a very high vaccination rate in Tennessee, so it's not really luck. It's people doing the right thing and getting vaccine into their children. So more than 95% of our kindergartners in Tennessee are completely vaccinated with all of the recommended doses of vaccine that we recommend for children, the CDC recommends for children under the age of 5. And we have not yet identified a case of measles in the state, which is great. There are cases in Georgia and there are cases in Kentucky. So it doesn't take much, and really in a global world, it just takes an airplane from someone in Portland, Oregon, or someone in Washington, or someone from in Europe. They've had more than 80,000 cases in Europe. To come over to Tennessee, we have a large international airport, and that infectious person walking through the airport could be exposing many people along the way. So it's a big deal in that the risk is there every day. If you are vaccinated, you have very little to be concerned about. But if you have a child under the age of 1, they've not been vaccinated yet, because the recommendation is to start vaccine at 1. If you are immune compromised, if you have cancer, if you have HIV, if you have a child who has an immunological condition that prevents them from being vaccinated or prevents them from mounting an appropriate response to vaccine, then those children are at risk. And so the choice of someone to not vaccinate their own child can actually spill over to cause illness in someone else's child. And
it wasn't that long ago that we declared measles like eradicated, isn't that right? Measles was wiped out.
Eliminated, yeah. Eliminated. So we no longer had measles in the United States, and yeah, it wasn't all that long ago. And
I
now
think it was 2000 is what I'm looking at.
Yeah, 2001,
right.
And then really the next big outbreak that we saw was the Disneyland outbreak, if you remember that, a few years ago, and that was they think an international traveler that came to Disneyland, and there were lots of cases that came out of that. We had a small outbreak of measles in Memphis a few years ago, only 7 cases. That 7-case outbreak cost the state more than $4 million because of the resources that it takes to investigate all the contacts and get all of them immunized and quarantine people who are infectious. And that whole response is really draining on the resources that we have in the state.
What are the counties that concern you most here in Tennessee?
There aren't specific counties that I would necessarily call out, but there are pockets of communities where people choose not to vaccinate. And from a demographic standpoint, those are typically middle class, upper middle class, highly educated, or at least college educated communities where they have a lot of access to information and they're smart folks and they have education, but they don't always know how to discern the source of the information that they're looking at. And really learning how to read a scientific publication and understand the epidemiology that's in it and the statistics that are in it takes a good bit of training, and it's difficult. Even for someone like me, I sometimes have to have people who understand statistics explain studies to me to help me understand why they are or aren't good studies. So we will see pockets of folks that kind of fall into that demographic that may be a little less likely to vaccinate their children.
That's so interesting that we're talking about highly educated people is what you're talking about generally.
Generally.
We have politicians now that are saying some stuff. How concerned are you by some of the stuff you're hearing from elected officials in some cases?
I think anytime you have someone who has a platform, whether that's a celebrity or a physician that's maybe on television, that is stating things that aren't proven in facts, in science, and in the science that we look at is what's called evidence-based, peer-reviewed science, and that means that people can repeat that study and get the same result over and over and over and over. So you might have a scientist that produces a study that finds something, but nobody else has ever been able to show that that's happened, versus studies that happen 10 or 20 or 30 or 40 different times and get the exact same result in huge numbers of people. Anytime we have someone who has a platform where they can speak to tens or hundreds of thousands of people and share information that is not based in science, it's really concerning, because that's how all of this spreads, right? That's how the idea that vaccines cause autism spread. That's how the idea that aluminum as an adjunct, aluminum salt in a vaccine, can cause brain damage. That's how all of those kinds of myths get propagated.
What about the religious exemption? How many, do you have any idea how many children use that? How many parents use that for their children? And what are your thoughts on that?
So in the state, it's a little over 2%, so it's not a lot of folks that use religious exemption. In comparison, though, there's only 0.1% of children of kindergartners in the state that have medical exemptions. So when we say medical exemption, we don't mean to every vaccine. That might be one vaccine that they had an allergic reaction to or shouldn't take for some reason. That's 1 out of 1,000 kids, compared to about 2.5 out of 100 kids that are claiming religious exemption. I think it's really important for people to understand that there are no large religious bodies that are recognized that have objections to vaccines. The Catholic Church has come out very loudly in favor of vaccinating. It is not against the Jewish religion to vaccinate children. So we have not been told of a religion in the area in Tennessee that has a large following that would explain 2.5% religious exemptions in the state.
And so that's interesting, because I wonder, what is the religion that says don't get vaccinated? And you're saying you're not sure.
That's right. We haven't really identified what that religion would be. What we do know is that, in the state of Tennessee, there is no philosophical exemption, which means you can't just say, I don't believe in vaccines, so I'm not going to get them for my children. We do know that some people who declare a religious exemption are doing so for philosophical reasons, and that's dangerous.
And so, yes, you say it's dangerous, and we're seeing these outbreaks. Do you see more to come? This is political in a way, but do you see things getting, the need for things to get even tougher? To remove a religious exemption, or we're doing pretty well in Tennessee, but is there a need to push things even further?
It's certainly the fear that we will see larger and larger numbers of people who are choosing not to vaccinate their children, and we see what happens in examples like Washington and California that have philosophical exemptions, and they have very high rates of unimmunized children, and so now we're seeing these outbreaks of completely preventable diseases. I will say that the American Academy of Pediatrics a couple of weeks ago, their leadership met and they decided that the #1 concern of pediatricians, and that's an organization that represents about 69,000 pediatricians across the country and Canada, they decided their #1 priority was in getting rid of religious exemptions to vaccines. And the World Health Organization has declared exemption to vaccines and the kind of the anti-vax movement to be one of the greatest threats to public health of this time.
Fascinating. Okay. Well, all right, that kind of sets the table for the discussion. We encourage you now to call in. What are your thoughts? There's the number, 615-737-PLUS, 615-737-7587. We'll take a break. Be back right after this.